Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about treatment options for neuropathy. Folks, if you or a loved one is suffering from neuropathy, you're going to want to listen up. We've got some great treatment options, conservatively speaking, and we're going to talk about that. So stay tuned. Okay, Dr. Mike, we've been talking about treatment solutions for neuropathy in our clinic for quite a while now, and it's really exciting because when it comes right down to it, we're in a great position to be offering patients really cutting-edge treatment solutions for neuropathy. And I think it would be helpful just to kind of review what is neuropathy, because sometimes it's confusing for the patient.
Neuropathy is a problem that many people don't know what to do with. Doctors have a difficulty to try to treat it because there aren't a lot of treatments. So we're always trying to come up with new things, look at all options to treat what we call peripheral neuropathy.
Yep.
So central neuropathy is not necessarily described, but that's when we think about the brain or the spinal cord, and there's different types of problems that come with damage, such as if we had a stroke, for instance. But when we talk about neuropathy, we're talking the periphery. The nerves come out of the neck, out of the spine, go down into our limbs, into our arms and our legs. And when there's damage to those nerves and the nerves aren't functioning properly, they tend to have a degradation backwards. That means the nerve dies furthest away, so you may feel your problems first in your toes, and it creeps up into your foot or extends from there. So we're really trying to suppress that nerve damage, which is why we call neuropathy or pathology in the nerve, to get under control so we don't have all these side effects, the problems that come along with damaged nerves.
Yeah. And when it comes to medical treatment options, it's pretty limited. So what's traditional medical treatment options for neuropathy?
Well, first of all, we like to try to figure out what may have caused it. And the most common things are like diabetes or exposure to some chemical. Alcohol or chemotherapy commonly can damage the nerves as well. So once that has occurred, there isn't typically a lot to do to reverse it. So the typical treatment option is more medication symptom management. We try to get the nerve pain under control. Person may be disrupted sleep patterns, so we give them sleep aids or nerve-related medications that try to take the hypersensitivity of the nerve to go away so you can get some sleep. So really the traditional model is to try to identify offending agents to get rid of that, and then just use medications to cover symptoms.
Yeah, but the problem is, as the medications are trying to help with the symptoms, the nerve problem gets worse over time. And then sometimes these medications have a lot of side effects, right?
The common treatment is the seizure medicine class. It's a group of medicines that try to treat something else, but does suppress nerve chemistry, does suppress nerve activity. So you're affecting the nervous system. When you're affecting the nervous system, you may actually bring on the same symptoms or perhaps worsen some of the problems that there are. So most common the thought is to get the nerve pain under control, but you may make balance worse, you may make their sleep or the fatigue worse, you may have emotional changes and dysfunction of the way your body's thinking, your brain is thinking. So neurological based medicines, seizure class medicines, antidepressant medications, although helpful for many, sometimes can be problematic.
Yeah, and we're in a great position with our multidisciplinary approach to offer some really cutting-edge treatment options that don't have any side effects. So there are a couple of different treatment options that we're currently using, the Neurogenx and the Stim Pod, which is a new addition that we're trying out on a few patients. What exactly do those treatment options do?
So a new innovative way to try to treat nerves and try to suppress the symptoms, but also repair the concept of the way the nerve functions, is to provide stimulation, to provide an electrical current which those nerves carry. And so the Neurogenx treatment is to try to aspects of getting into the nerve, bringing some microvascular improvement, help the nerve replenish in a sense of its health as much as at least the part that's remaining, and prevent some of the progression degradation. Stim Pod is another nerve stimulation device that we use in a different way to provide kind of a drowning out effect. So you have an input through this wire called the nerve, and those signals cause a lot of symptoms and a lot of troubles. The Stim Pod can potentially override that, get those symptoms to settle down and reset the nerve, kind of rebooting your computer, if you will, getting the wires to work the way they're supposed to without having a misguided component of the electrical impulses.
Yeah, and it's really neat. You know, patients are typically coming into the office twice a week for about 12 weeks, where we're doing the Neurogenx treatment. We're replacing those pads on their lower extremities and the legs. Oftentimes we combine that with a regenerative medicine injection to help repair some of the damage to the nerves. And the preliminary research is showing some pretty interesting findings where we're getting some increase in nerve fiber density, which is exciting. The Stim Pod is to be used in between treatments, so we're putting together a protocol where the patient would be able to use a small device for home use in between. And our hopes that when we combine that with our physical medicine clinic, where it's managed by yourself or Molly, who's our nurse practitioner, as well as other treatment options, including chiropractic care and physical therapy. As you said, oftentimes these patients have a lot of deficits with their balance, so the Hanova robotics and Colleen's work really helps out with that. And then finally too, looking at the patient's overall nutrition. Our whole food medical weight loss program, NutriHealth, is a great solution. So folks, if you have a loved one or somebody you know that's suffering with neuropathy, the first thing you want to do is give them our information. You're going to want to come in and see Dr. Marciello or Molly for a new patient exam so that we can go over all of those exciting treatment options for you. Best of all, our clinic takes most insurances. For more information about our clinic, you can always check us out on our website at maragalmedical.com. And there is a wealth of information on our YouTube channel. Please consider subscribing. Great opportunity for you to just educate yourself about all of the exciting options here in our physical medicine clinic in Leominster, Massachusetts. Well, that's it for today. Have a great day, everyone.